Look at how good you look.
Oh, it's the blur effect.
I can't hear you.
Zen Essentials, because your health is essential.
Ryan the Farmer, Part 12.
I'm your host, Dr. Alexis Hazen. I'm a board-certified plastic surgeon who specializes in breast surgery and gender-affirming surgery and cosmetic surgery. I have a holistic approach to wellness and longevity. I've been practicing in New York City for over 20 years and continue to learn and educate as an associate professor at NYU Langone. Please join me in our mission to discover Zen.
Welcome to the Dr. Zen podcast. My guest today is Dr. Eduardo Rodriguez, who kind of needs no introduction. He is a world famous plastic surgeon. He has led NYU's Department of Plastic Surgery for the past 10 years.
Going on 11 soon.
We're going on 11. And in addition to being a brilliant surgeon and a wonderful friend, he also is a great chef, and he makes a mean paella. And I know this from personal experience. So welcome, and thank you so much for being my guest.
Thank you, Dr. Hazen. Thank you, Alexis, for having me. It's wonderful to be doing this. I
Yeah,
couldn't
it's
think
great.
of anybody better to be doing a podcast with. Anything you ask, I'm here.
Awesome. I mean, at the end, I'm going to ask you for your paella recipe.
Of course. It's not a secret. It's just time, tincture of time.
I love it. So I thought we'd start out just talking a little bit about your background in terms of your training and how you kind of your route to becoming a plastic surgeon. Everybody has a slightly different route, and there's a lot of training involved for all of us. So I thought I'd like to just hear a little bit about how you came to be where you are.
Sure. After college, I went to college at University of Florida. I went on to dental school. So I started my career as a dentist at NYU dental school, and after
It's a
dental
great dental school.
Yeah, I was very fortunate to not only be at NYU, but also experience Manhattan, which was a wonderful experience. It got me out of the 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 local home skirt of Miami, Florida. So it was a wonderful experience to be in Manhattan. Initially very intimidating,
Yeah,
but I think shaped me to the person I am today. I think it had a lot to do with who I am and my experiences here.
yeah,
So I was here for dental school, and after that, I did a year as a dental anesthesiologist. So there was a program at Miami where after you graduate from dental school, in order to get a dental license, you had to
yeah,
do some kind of internship. Most dental students do what's called a general practice residency, where you can work, like for example, in a hospital, and you're a general dentist in a hospital setting. But I kind of thought I was going to become a surgeon, an oral maxillofacial surgeon,
mm-hmm.
and what would put me in the best position was to do a year as a dental anesthesiologist, whereby there are certain programs, and in this case, University of Miami Jackson Memorial Hospital, and affiliated with a VA hospital in Miami. As a dentist, you kind of come in as a PGY1 anesthesia resident.
Wow.
It was pretty unique, and it
That's
exposed.
really unique. I didn't know this chapter of your life. I don't know how. I feel like I know
Yeah,
everything about you. How do I not know this?
I don't think I've
Who
really
are you?
talked about it a lot because it just I know exactly who's that masked man. No,
It
but that
just
was a
no, it blurs into the rest of the training, which you did so much more training after that that it's sort of
That's right.
blends.
Just kind of another thing, but that was
Yeah.
a good year because it did help me get into a good oral surgery program. So after
Yeah.
that year of anesthesiology, learning medicine and anesthesia and caring for patients in the operating room, I came up to New York and I did my residency in oral and maxillofacial surgery at Montefiore Hospital and its affiliation with Albert Einstein.
Right.
And I was there for 4 years, and I had a wonderful time. I learned a lot about, how to do skeletal osteotomies, or cutting bones to move
Yeah.
the face around, and those kinds of things. And that will come to play later And then during my years there, I had a wonderful mentor by the name of Arthur Adamo, who unfortunately just this year passed away. But he was a
Oh,
wonderful guy.
sorry to hear that.
Yes, he lived a good life, but he was a great surgeon, good friend, good mentor. And he basically told me there's not going to be enough in this practice for you to kind of fill your tank. Like you're
Mhm.
going to have to go a little bit further. And I'll tell you, Alexis, when you're hearing that, when you've done so much training, you're like, where is it coming from? You know,
Right.
is this like his
Is he
nice way of
scaring
telling
me?
me,
Yeah,
like, I need more? Like,
yeah.
you know,
I'm not,
that kind of guy?
yeah.
No, but he was like, I think you need to go on. And he was very supportive. And he goes, you may want to consider going to medical school. Now, at that time, it was kind of becoming in vogue that some oral and maxillofacial surgery programs throughout the country were getting affiliated with medical schools. They were getting medical degrees as part of their training.
Right.
So I didn't want to kind of go back and do 4 years of medical school, but what I did was apply to medical schools that were affiliated with an oral and maxillofacial surgery program, since they would have a bit more of an understanding of what my desires were.
Yeah.
So I was at the final year of my oral surgery residency. I was planning to graduate in June of 1992. And that year I applied and I got an interview at Richmond, the Medical College of Virginia.
Yeah. That's a good program.
Yeah, my wife and I got married. We landed, we went to our honeymoon. We came back to New York and we got in my truck and we drove down to Richmond, Virginia for my interview the following day to
Wow.
go to medical school.
Where'd you go on your honeymoon?
We went to St. Croix.
Oh, beautiful.
So so the worst. So we had a great honeymoon in the Caribbean, wonderful time. And we stayed at this beautiful place called Villa Madeline. But anyhow, we came back and then the following day we got in, we got in my Explorer, we drove down. And on the way there, from New York to Baltimore, you obviously go down 95 South.
Yeah.
And there was this sign, which I thought was interesting, Johns Hopkins Hospital. I'm like, wow, maybe I should stop there and take a look at it. And I go, well, we were tight on time, but maybe on the way back, we'll check it out. Anyhow, we went to Richmond. The following day, I felt really great there. I had some great interviews.
Yeah.
We were driving back. I stopped by this place called Johns Hopkins Hospital. I went, wow, that's really impressive. And in those days, that was
You just stopped by because you saw a sign.
yeah. And I thought, wow, I really like to check out this place. I've heard about this place. It's an amazing medical institution.
I think you're guided by some higher source.
Something, I don't know. I'm certainly
Interesting.
very spiritual that way,
Yeah.
Alexis.
Yeah. I mean, you should be after that.
So yeah, so we stopped by Johns Hopkins Hospital, and in the middle, it's a big campus, but in the middle
Yeah.
of the campus is like the first building, which is the building with what they call the dome.
Mm-hmm.
And we just parked the car right there in the cobblestone street, and we walked in. Like, it was
Yeah.
different time in 1992,
Yeah.
right? In that time. So, sorry, this was now we're in 97. Forgive me,
Right.
we're about
Yeah.
to graduate. So we walk in. And in the dome, there's this really impressive statue of Christ. And yeah, just like, Christ is looking at me. And we're reading all the history and,
Yeah.
and the dome is round. And they're talking about here's where, organized medicine began. And the concept of rounds on your patients began because the physicians used to walk around the rounds of the dome to see their patients. So they would do their rounds around the dome. So
I did
it's
not
just
know that.
awesome.
I did not know that it
Yeah,
was called rounds because of that.
because of the dome. I didn't know all these things. So I thought,
Wow.
wow, really, what a great visit. We came back to New York. Lo and behold, the dean of student affairs at MCV in Richmond, Richard Mesmer, sent me a note that I had been accepted, and I went to medical school in Richmond, Virginia. To fast forward, after that, I thought, well, I'm gonna go get some good general surgery training. And sure enough, I applied to Johns Hopkins Hospital and they took me in as a general surgery resident. Now, while I was there,
Amazing.
I was there, I get exposed to plastic surgery. Although I had done plastic surgery rotations as an oral surgeon in New York,
Right, right.
this was very different.
Yeah.
Um, and I got to meet this man by the name of Paul Manson and a number of surgeons there that were doing just really amazing things. And I thought, wow, I'd like to do this. Now, my old mentor at Albert Einstein in New York um, said, why don't you apply there and stay in plastic surgery there? And I had met with Paul Manson, and Paul Manson told me there were no positions available. So unbeknownst to me, Arthur Adamo from New York wrote Paul Manson a letter saying, I'm always embarrassed to say this, but Paul Manson always uses it. He said, listen, Dr. Manson, please look out for this young talented resident. In my 25 years of residency, I've never trained a person who has this understanding of surgery and navigating the face and the skeleton. Please look out. I think this kid will do something big in the future. There were no opportunities. He did keep his eye out for me. And in my first year of general surgery, there was a show that they were doing at Hopkins, and that was kind of the beginning of like reality medical TV.
Oh,
And there
yeah,
was a
yeah,
show,
yeah. Yes.
there was a show they
I
were filming at
remember. I
Hopkins.
remember that
It was
show.
called Hopkins 24/7.
Yep. I remember it.
And on that show, the they were Hopkins had a combination of an integrated residency, which means residents or a medical student matches into a residency right out of med school, but they also had an independent track. So
Right.
individuals that had additional training can apply. And one of the residents who was in her second year of plastic surgery on national TV, she decides she doesn't want to do this anymore and she drops out.
I forgot about that.
Yes,
I used to watch the show because it was one of the first and
sure,
only reality shows, and it was about surgery. And so
exactly.
that, we all were obsessed with it. It was like, ER, but
Everybody
it
was
was
hooked
surgery.
because we didn't have
Yeah.
anything like that.
Okay, so she drops out. And did you think immediately?
Well, I didn't watch the show,
Oh,
but the next day I was in the outpatient center and I was going to go operate with one of the general surgeons, and I bump into Paul Manson in the hallway, and he had as you know, he has a very deep
yeah,
monotone
yeah.
voice, and he's walking
Eduardo.
down, and he goes to me,
Oh, yeah.
"Do
The
you?"
face.
Yeah, he looks at me and he goes, "Do you believe in God?" And I didn't really know how to interpret this.
Yeah, you're like, yes,
Yeah,
no.
and he
What's the
goes,
right, what's the right
and
answer
he's like,
here?
he goes, one of my residents dropped out on national TV. We have a spot. I want you to be in my office at 6:30 in the morning on Saturday for an interview. Can you do that? And I go, yes, but I'm supposed to be traveling to Boston. I have an interview in Boston at the Mass General and Brigham program. And he goes, I go, I bought my ticket. And he said, why don't you cancel the ticket? I'll reimburse you. I'll let them know that you're going to interview with us. And I went, okay. And
Wow.
I interviewed with all the plastic surgery faculty. There were a number of us. There were like 4 of us interviewing for positions. And after that week, I got the spot. And
Wow. That's amazing. What a
yeah, it worked out.
story.
It's a great story. And I stayed there for plastic surgery.
Yep.
I did my years there. And at that point, I was trying to figure out what I wanted to do,
Yeah.
Alexis, because I
Yeah.
thought, well, kind of the traditional track for an oral surgeon, plastic surgeon would be to do craniofacial surgery,
Right.
do like cleft lip and palate and the congenital stuff. And that was interesting to me, but it really didn't like catch my eye.
Right. Because it didn't encompass all of your training
Correct.
because you were all over the face and head and neck.
Exactly.
Yeah.
But there was this creation of this field when I was a resident. It was this inception. It really didn't really catch on, but there was a field called reconstructive microsurgery.
Right.
And at that time, like when I was a resident, we were just doing, there weren't like free flaps for breast reconstruction.
Right.
There were like pedicle tissue flaps. So it was just kind of rotational flaps. and they had just started what was called the muscle sparing free tram.
You're right.
So that was
Right.
kind of interesting, but I was reading articles about, people doing fibula flaps, like even one of our illustrious,
Yeah.
alumni by the name of David Hidalgo, who really created the fibula flap, but it wasn't something that people they just weren't
No,
doing that
no.
throughout the country. It wasn't common
So now
norm for
you're
training.
talking, is this like 2000-ish that
This
you're
was this was in so when I was trying to figure out what I want to do is it 2001.
2001? So it is interesting because now it's only 23 years later, and like you said, back then there were some free flaps, and we call them free because it's connecting blood vessels, removing tissue that's connected to blood vessels and then reconnecting the blood vessels. But there were just a handful of the different types, and they weren't commonly used. And now, you could probably list 35 different free
Right.
flaps, and then perforator flaps, the next permutation of that. And it is interesting. I mean, that has grown so tremendously in our professional lifetimes. It's really cool.
Absolutely.
So,
Now,
there weren't, so you were sort of microsurgery and facial reconstruction then was on
right,
your radar.
definitely on the radar. And Paul Manson suggested, why don't you take a trip out there? Which was a good idea. I go, I should look at this before I'm going to go
Yeah,
halfway across the world. So that year in 2001, and well, what happened at that point, the independent track was only 2 years. So I was in my first year of plastic surgery, and Dr. Manson would always send the junior residents like myself. The annual meeting that we would go to was the Association of Plastic Surgery meeting.
right.
And that year it was in Seattle. And with that, we had the plan, we would go to the meeting in Seattle, and Paul Manson said, I'll give you 2 days to go check things out. So my wife came with me to Seattle, and then we kind of jumped a pond and we flew to Taiwan.
Wow.
And I saw this place and it was remarkable.
And that was
Uh,
Chang Gung?
that was Chang Gung Memorial
Yep.
Hospital in Taipei. And I had never seen anything like this. There were like 15 full-time plastic surgeons on faculty. This was,
That's,
think about it, in 2001.
yeah.
They ran 24 operating rooms. It was a major department. They were doing free flaps up the wazoo. I had an, it was everywhere, and I had an opportunity to meet with this remarkable person who would later become my mentor by the name of Fuchan Wei.
Yeah.
So he interviewed me, and he hosted my wife and I. He took us out to dinner. He was really wonderful, and I met with him. I interviewed with him, and at that point, I was trying to see if I could do 6 months of craniofacial
Yep.
with Yu Rui Chen, and then 6 months at Fuchan Wei. And Fuchan told me, well, there's going to be a lot for you to learn in microsurgery, so I would recommend you just do a year with us. And I said, okay. So I committed to that. I applied to it, and then he formally accepted me. So to fast forward the clock, I was about to finish my senior year.
Yep.
We were about 3 months. We were about to finish and move to Taiwan in July of 2003. Now, prior to graduating, there was something happening in Asia, which was, I wasn't that concerned about it, but my wife was very concerned. It was
Was it
this
SARS?
four-letter word called SARS.
Yeah. Right. Yeah. I mean, that was a big deal.
It was a big deal. And I was thinking, no, it's going to be okay. It's going to be okay. And unbeknownst to me, my wife, Anna Maria, spoke to Dr. Manson. I'll never forget it. We were visiting our family as an Easter, and she called Dr. Manson and had a conversation that she was really concerned for my health and safety. And could he talk to me about maybe, number
Not,
one, evaluating what the current condition is in Taiwan, and secondly, maybe we want to postpone my trip.
wow.
Now, yeah. Now, Paul Manson had orchestrated, which was wonderful. a AO traveling fellowship grant, which he got for me, and it provided a little bit of a stipend, which was really helpful. And the goal was that I would potentially come back and be faculty at Hopkins. So as we were about to graduate, they got really bad in Asia.
Yeah.
And at that point, a couple of things happened which were completely serendipitous. There was a faculty member at shock trauma that at that point was dismissed. So there was an opening in the trauma center.
Mm-hmm.
Dr. Manson suggested, we got an opening. Why don't you stay back for a while? Let's let the SARS clear.
Calm down.
And then we'll go.
Yeah.
So I took a job at shock trauma, which
Amazing.
wasn't my plan.
No, right.
But I started working there in July, and I was seeing things, Alexis, that, yeah, I had been a resident there, but when you're on faculty, you're kind of drinking from a fire hose.
Yeah. And
And
you were seeing gunshot wounds and
everything.
car crashes and
Oh.
multifacial trauma and
Absolutely.
middle of the night. Yeah. And
so-
you were ready and armed. I mean, you'd been working for this for, at this point, 10 years, right?
Exactly. So now I'm in it as a junior faculty. I'm about to go to Taiwan. So it's kind of an opportunity to let's start prepping my skills.
Yeah.
And they had a laboratory there, which is called the Maryland Anatomy Lab.
Oh, yeah. I've been there
could
many
go
times.
there, and they had access to tissue, and I can practice these flaps that I didn't really know much about. And so we began to create this opportunity. As soon as SARS cleared, my wife and I we moved to Taiwan, and then that place really just opened up the campus for me of the possibilities
Yeah.
of deformities of whatever capacity, whether it was trauma or congenital or oncologic from cancer, that we could repair with moving tissue from one part of the body to another and connecting it with blood vessels. So
you were able to reposition the bones, get the bones back together, and then if there was what we call a soft tissue defect, which means like skin and muscle, you could fill that in with moving tissue from elsewhere.
That's correct.
And so how long were you in Taiwan for?
I was in Taiwan for 7 months. I was supposed to be there for a year. But then another thing happened. All these things that I'm describing, all this.
You're like at the mercy of the winds.
I really am. I'm just like a leaf in the wind.
It's a good thing you're like a reed. You bend with the wind. You don't break.
So though keep in mind, I had been in shock trauma for like 4 or 5 months.
Yeah.
So I get a call from Paul Manson, and he goes, Eddie, shock trauma is underwater without you. We need you to come back ASAP. And I go, Dr. Manson, I am happy to come back, but you need to have that conversation with Professor Wei.
Right. You're not going to be telling him you're jumping ship early.
Yeah, this is an adult conversation.
Yeah.
I just go where I'm told.
Yeah.
And he goes to me, how's your experience so far? I go, it's been great. I'm really, my skills have improved tremendously, and I can certainly carry on these operations. He goes, I'm going to talk to Professor Wei. So Paul Manson talked to him. We used to go hiking with Professor Wei on Sundays.
Really?
We used to hike every Sunday.
You're kidding.
Yeah, we used to hike in the mountains. All these hiking trails.
Beautiful.
In Taipei, which is really nice. And it's kind of, there's a hierarchy. So the elders would always be in the front. So I would always be in the back. It's like in the back of the class with the medical
right.
joking around with everyone, having a good time back there. And then Fu Chen goes, Eddie, I want you to come to the front and talk to me.
Oh, wow.
It's a very hierarchical system.
Yeah.
And I really appreciated that. And he told me, tell me about this shock trauma job. And I told him what I did and what could be a great opportunity. And he goes, your mentor, Dr. Manson, called me and he would like you to get back sooner. How do you feel about that? And I go, well, I gave you my word that I'd be here for a year. So my responsibility is to you first and foremost. And he goes, I appreciate that, but I think we need to get you back.
Really?
Yeah, he goes, this is a tremendous opportunity, and I wouldn't want us to lose out on this chance.
Yeah.
He said, let's finish out this next month, which was I was finishing up my block with him,
Yeah.
which was actually a good way to go. And he goes, let's get you back.
Wow.
So that's how that happened.
Okay, my favorite thing about your Taiwan experience, though, is how tall are you, Dr. Rodriguez?
Oh, I'm 6'4".
6'4". Okay, my favorite thing is when you get there, they, you know, the average height is probably 5'6", right?
I think that's
Something like that.
conservative,
And
yeah.
they provide you with scrubs.
Yes.
So what did the, I'll never forget this. You were like,
Yeah, so
what did the
pretty much
scrubs look like on you?
everybody, first of all, everybody has the normal dark green scrubs.
Right.
Everybody. So then I go to try these on. These things really don't fit me. I feel like I'm wearing Bermuda shorts and a polo shirt, and it's probably like, my youngest brother at
Yeah,
his youngest
yeah.
age. So then they go, no, we have these special scrubs for you. They weren't even dark green. They were like day glow, bright green, like Madonna, like a virgin,
Yeah, yeah.
MTV video.
Right.
It was bright green. So
Did they
that's
fit
number
though?
one. They fit. They were
Yeah.
a little short, but they worked.
Yeah.
But then the operating room was another situation because now they don't have a hospital gown that fits me.
Oh, right.
So the hospital gown was actually pretty short. So when you sit down in a surgical chair to do microsurgery, the gown is like above my knees, like very much above my knees. So now they figure out a contraption where they take a sterile surgical sheet and they put a towel clip around my waist so that I can sit down and my thighs are sterile. And then since the sleeves are
Sleeves
short,
are too short. Yeah.
they put the gloves on and then they put sterile surgical tape around my gloves
God. It's
and
just,
my forearms. And that was
that
my
was what you did.
that's what I did daily.
It's the best. It's
That's what I
amazing.
did daily. And it was great because everybody could easily find me because I could be in the cafeteria, hundreds of people, and I was the only guy with the bright green,
The neon.
the hazmat suit that they would just find me. It was easy.
Well, also the fact that you're 6'4", kind of, you
Yeah, I
stuck
stood
out a
out.
little bit anyway.
It was stood out, and it was so funny. I was just commenting on this story yesterday, and it was kind of interesting. My wife and I would go to Taipei, and all these young Taiwanese kids, they would look at me and they thought like I was a spectacle, and they would say Shaquille O'Neal, and they would take pictures
Yeah.
of
Yeah.
me with them, and they would
Yeah.
say Shaquille O'Neal, and they'd be smiling and doing all and they thought I was Shaquille O'Neal. I was like the giant walking amongst Taipei.
Oh my God. That's so brilliant. Okay. So now flash forward, you get all trained up.
Yeah.
And then you have this incredible career at shock trauma. You're doing a lot of trauma. And then things start changing and the environment's changing. And all of a sudden, people are talking about doing face transplants. And
Right.
you nutter, are
Mhm.
like, I'm going to do a face transplant.
Yes.
So I guess I have two questions. One is, if you could walk us through the first face transplant you did, and
Yes.
then I guess I'm just really curious about, the mindset of deciding to do something you've never done before that is really actually revolutionary, and how did you come to that?
Right. And it's a
Yeah.
great question. So to back up a little bit, when I come back from Taiwan, keep in mind that we're in the midst of these wars with Iraq and Afghanistan.
Oh, right.
So I'm asked to volunteer, which I did proudly so, care for soldiers coming back that were cared for at Walter Reed and National Bethesda with horrific injuries.
Oh, wow.
The reality is, even as sophisticated the techniques that I brought back from Taiwan, it wasn't enough to treat
Yeah.
these individuals. So we got a lot of support through the Office of Naval Research. It was part of the Wartime Protection Program, and we were granted monies to begin our studies looking at face transplantation. At that point, a face transplant had not been done. So we
Oh,
began
right. Okay. Yeah.
model.
So that your research was even before the first ones were done. Okay.
Correct.
Got it.
So now we're getting the momentum. We got the research. We got the background. We can certainly do this. I was dealing with deformities that we weren't necessarily getting better.
Yeah.
And then they do the first face transplant in Lyon, France,
Right. In France. Right.
on Isabelle Denoir, the
Right.
group
Yep.
of Max Bernard and Bernard Duvichel, which was amazing. And
Amazing.
that was a game changer. The fact that you can evaluate an individual, in Isabel's case, who was missing her nose and her mouth, and they can take that piece of tissue like a
Yeah.
block with the skin and the muscles and the nerves and the cartilage of the nose, and just reconnect that and just replace it as one piece. That was a complete game changer for sure.
Totally. And as far as plastic surgery had come, which was very far at that point, because we were moving tissue, from one part of the body to the other part, and we were reconstructing bones and even transplanting bones within so we were using the fibula to recreate the jaw, all that stuff. It was still quite imperfect in terms of how people looked. You
Correct.
could maybe get a functional outcome, but people looked like they'd had 10, 15 operations, and and there was a lot of scarring, and in polite society, that people weren't like doing so well.
That's
So,
correct.
okay,
And you're
so
absolutely right. They would look acceptable in a two-dimensional still photograph, but when you would look at them animating and eating and speaking, it wasn't ideal. It
no.
was far from ideal. So now I started evaluating candidates, because now I'm going to transition from laboratory research to actually a clinical trial,
Right.
which we have to apply for, and we have to go through a pretty rigorous process, which is called an IRB process. And you know this because you sat on IRB committees and you evaluated our work for so long. Very
Yeah,
rigorous,
it is.
but very much worthwhile. Our institution approves us to go ahead and move forward with the clinical face transplant. And I evaluated a number of patients, and a patient who I can say publicly was Richard Lee Norris. And he was a person that I had worked on for so many years. And he was very well versed, and he would say, Dr. Rodriguez, how are you going to make me look like what I used to look like before? They're doing face transplants. Can't you do this? And I was just kind of pushing it off. I didn't really know yet, but we
Yeah.
started organizing a team. We started putting my team together, and we started rehearsing. And sure, you can practice in a lab, but absolutely, it's exactly what you said. You're doing something you've never done before. There's no recipe. There's not a textbook of how to go about this. And the hardest thing in that type of operation is that although Richard Lee Norris has deformity, he's currently safe.
Yeah.
The wounds
Yeah.
are
He's
covered.
alive. He's existing, breathing, living.
Correct. And now to do a face transplant, what some people don't realize, you are going to put this patient in harm's way.
Yeah.
You're going to make them worse. In other words, we have to take everything off to go back to what I call the point of no return. You have to create the demolition so that you reconstruct the face from a normal foundation.
Yeah.
And that's something we don't train to do that.
No.
We're used to just building and building.
Yeah.
But that was the tough thing. So in order to feel confident to be able to do this, we trained a great deal. And we had also done one near exercise, which is called a research procurement, where a family very generously donates their loved ones so that we can actually do a portion of the rehearsal. And once we did that rehearsal in the operating room, I was pretty confident that we can
That you
pull
could
this
do
off.
it. And so just to backtrack, the rehearsals were primarily on cadavers, so dead people, but
Correct.
who had given their bodies to science. And so you could recreate the operation without any risk of harming them because they're already dead. And then the
Correct.
procurement one is somebody who's who's an organ donor, right? And then they also agree to donate their face just for the experimental purposes.
That is correct. So, but
Okay.
just to clarify to the audience, at this point, this individual is brain dead.
Yeah.
And that's a tried and true process where they verify that this individual is complete brain dead through a number of checks and
Yeah.
balances.
Yeah. So there's
And then
no,
they're approach the family and they consent to donation.
yeah.
And that's when we practice that area.
And how old was Richard when you operated on him? For the face
Yeah,
transplant?
Richard was in his early 30s. He was like
And
31 or
and
32,
he'd been
something
your
like
patient at that point for about 5 years?
5 years.
Yeah. So tell me what it felt like when you got all the stars align and there's a donor who's willing to give their face and Richard gets called in to have this tremendous operation where you're gonna remove all the work that you've done for 5 years and start from scratch almost.
Correct.
So how'd you feel?
That was, you know, the way that happened that day, we had just moved into our home, and you know what a move is like,
Oh,
furniture.
yeah. You
And
and your wife had just moved.
yeah, we had
Yeah.
just moved into our home, and I had just taken a shower. We were so happy. We moved in, the house looked great. And as soon as I laid down, I got a call from my administrator at Shock Trauma that we've identified a donor and we need you to confirm that it's a acceptable match.
Wow.
So what's important for the viewers, once you accept a donor, the match is not just on blood type. There's a number of things that we look at. We look at antigens, we look at antibodies, and also something to realize that when a person receives a face from another individual, this patient, in this case, Richard Lee Norris, will be on anti-rejection medicines for the rest of his
Yeah,
life.
that's right.
And so we need to make sure that the match is as ideal as possible. So we went through that battery of tests and it was a perfect match. And it's always difficult dealing with the donor family because his donor, who eventually became, the family was very public,
Yeah.
was a young man that had been hit, was pedestrian struck.
Oh, God.
Young
So
man, but a young
tragic.
man who was going to enlist in the military.
Hmm.
And he was an organ donor himself. So he wanted, and his wishes were, someday I pass, I would like someone to benefit from all of my organs.
Wow.
And the
Such a
family,
beautiful thing.
yeah, it's wonderful to be able to do that. And, my wife and I are organ donors, and I think
I
it's
am
something
too.
that we're in major crisis in this country. So the more people we have listed to be organ donors, the more we can help out individuals in
Yeah,
time.
absolutely.
So perfect match. We get ready to do this operation. We're all ready. We get everything going. And we work in 2 rooms together. We had practice with all of our teams in the operating room. You've been a member of so many of these practices with our
Yeah.
team. And it's just, as you know, we've done it so many times that it's just a well orchestrated waltz, for lack of a better
It really
definition.
is. I mean, it's sort of the way with your leadership, the way it turns out is each step has been done so many times in the 2 different rooms that it's like a dance. And everybody knows what happens after A, you go to B and C and D. And then there's also like, well, what if, what if, what if? And in the cases that I've been involved with, they kind of went exactly as planned. And there wasn't really anything ever that came up that was a shocker, I mean, you can
That's right.
never account for, how long it's going to take. But other than that, it's like everything went as planned.
That's exactly right.
Yeah.
And you reach that point, the point of no return, where you have to take everything off so
Yeah.
that you fit this new face. And that's always a anxiety provoking moment, no doubt about it. But then you just kind of get past it.
Yeah.
And when you put this face on, after you plate and screw the bones and you align the nose, or you align the ear canals for the ears and the eyelids, and you make sure the jaws are together, and you transplant 32 teeth and the tip of the tongue, and you put everything together and you look at this, at the end, it's the most surreal experience
Yeah.
because there's nothing that we do that can replace a whole missing body part, like a
Yeah.
facial region. Like, this operation is the only operation that can do that in one swoop.
It's really, I mean, it's obviously groundbreaking. And then since then, how many transplants, face transplants have you done?
With the most recent one was 5, and
Five.
the more recent one is probably they're all interesting, as you know,
Yeah.
Alexis, you've been on this journey with me, but I think this most recent one is uniquely interesting.
Yeah. So tell us a little bit about that. I mean,
So
some
with,
of our listeners probably know about it, but it's
of
super
course,
cool.
so the most recent one was a gentleman, but it's public, by the name of Aaron James, who had a high voltage electrical injury. His line of work is kind of getting in the truck that raises the bucket up
Yeah.
to the high powered lines, and he took about 7,400 volts through his body.
It's
And usually
amazing
that,
that he's alive.
absolutely,
I mean,
that amount of
that's a minor miracle.
Of course it is. That
Yeah.
that level of voltage coming, and what happened, he was carrying the replacement wire, the conduit wire to replace the wire,
Yeah.
and an open wire touched his face, but with the wire in his arm, it took off his arm right above the elbow,
Oh my God.
and the electricity came through his arm shoulder, went across his heart, and he had a big hole in his back by his scapula, by his shoulder blade. It's a miracle that guy's alive, because usually it's just your
Oh
heart
yeah, that
stops.
would stop the heart. I mean, you know, like do you think about, doing shock for
Exactly.
defibrillation, like, that can stop the heart. So,
Of
wow,
course.
that's amazing.
And that's why I always say in all these things, and I've been very fortunate to be a part of every experience, whether it's a transplant or get to know these people or deal with these patients who are donors. I think in all of this, there's some form of celestial intervention that makes things happen.
100%. Because to find, I mean, the fact that, with your first face transplant, getting a perfect match, I mean, that's like lightning striking twice,
Exactly.
it's not, it doesn't happen. So, and so what was the injury that
So
you
his
corrected?
injury, the biggest injury was the face. So he was the whole left side of his face, including his eye, his nose, which went over to the other side, lips, mouth, nose. This was all injured. But what was unique is that they tried to save the eye, but they had to remove the eye. So
Oh, okay.
when I evaluated him, they asked, and we talked about, is there a possibility you can transplant a face with an eye?
Hmm.
And I certainly had never done one. There's nothing in the literature that claims, well, there are, as I went through the literature and we looked at the history, there are only 2 claims of an eye transplant. One was in the 18th century, where they took, I believe it was the eye of a rabbit and put it in a human. Didn't work out too well.
I'm sorry.
Yes. And then there actually was a more recent one in 1960s that was performed in Texas, where a prominent ophthalmologist claimed that he had done a whole eye transplant. And what he had done, he had taken a portion of the eye of a cadaver and put it on an individual that had a global injury. But then he had to retract the information that he had revealed to the media, because it wasn't a whole eye transplant.
Oh,
So
okay.
historically, there had never been
You're right.
one.
And
But
you did, and the reason
yes,
why you thought you could do it is because the optic nerve was still in existence on the inside.
right.
Right.
But,
Okay.
but with that, the optic nerve, Alexis, as you know, most people know, the optic nerve is part of the central nervous system.
Right.
When we transplant a face or even arms, we connect the peripheral nervous
Yeah.
system. That's why we get function, the hands move, the face can
Yeah.
smile, they have sensation. But the central nervous system, that's kind of a black box. And when
Yeah.
people have spinal cord injury, you don't see recovery.
No.
So, at that point, I really wasn't aiming to transplant a face with an eye so that he could see, but would it be possible to maintain viability of the retina? In other words, could we establish blood flow
Yeah.
through the vessels that feed the back of the eye to give retinal viability? And that was what we were hoping for.
Mm-hmm.
So we went ahead and began our routine exercises like we normally do with our team. And instead, we included the eye with the face, and we took
Wow.
the optic nerve, which is the central nerve to the
Yeah.
eye, And we also dissected these tiny vessels, the ophthalmic artery and the ophthalmic vein, with the face. We did a couple of novel things to minimize the ischemia time, because out in the literature, what they say is the amount of ischemia that a retina can tolerate maximum is about 90 minutes.
Oh, that's a
However,
lot.
yeah, but there's one published report that if you're able to cool down the tissue through hypothermia,
Yeah.
that you extend viability or extend ischemia time to up to 3 hours. So we did once we procure the face without disconnecting from the neck, I did a small bypass from the superficial temporal artery and vein to the ophthalmic artery and vein in the donor while it was still being perfused.
Yep.
And we did that in about 30 minutes, 29 minutes to be exact.
Uh-huh.
And then once we were ready in the other room, we transplanted the face with the eye.
With the eye, and you did the eye first,
Yes.
basically. Yep.
So now where are we today? We're about 9 months, and it's funny, he just landed here today for his routine follow-ups. What are we seeing in the eye?
Yeah, what are you seeing?
The back of the eye, the retina is beautifully perfused.
Wow.
The intraocular pressure has now become normal. It's about the same level as his normal right. He has a normal right eye, and the pressure is about 10 to 12 millimeters of mercury.
That's
The
so
eye is
cool.
moist, although he cannot see. We have confirmation via a number of different mechanisms that the brain is perceiving light flashes that we flashed through his transplanted eye.
And you getting that through PET MRI?
Yeah, through a number of, through
Yeah.
functional MRIs and all these
Wow.
different mechanisms. We're seeing the potential for evoked potential. So we're very cautious on how we're interpreting this.
Sure.
But there's no doubt there's something happening in the brain. Signals are coming through that lens of that new camera or his eye that are reaching the brain. There's no question. But he cannot see.
Uh-huh.
The globe is beautifully viable.
Uh-huh.
No sight, but there's something happening in the brain. There's a cortical response.
Wow. Now, I know you don't know, but do you feel like either he will be able to see or this is a possibility for the future?
I think I don't really know he's going to see or not, but I think what we have now, and I think Leslie Bernstein deserves the credit for this, because when I talk about the lens of a camera, I go, we have the lens of a camera, we have the body of the camera.
Yep.
We're taking pictures, and her analogy is, yes, we're taking pictures, but there's no film.
Yeah.
So now we've been in some conversations with some unique engineers that work on this, and I think maybe the next level is we need some kind of digital interface, whether it's an electrode or it's a microchip. We need something like this, but I think we're learning. We're just beginning to tap on how do we define vision for people that haven't had vision when they're receiving an impulse in the brain.
Yeah.
And their visual cortex is lighting up that there is a message coming through. So it's
like
exciting.
you need the interpretation of the image,
Correct.
right? Yeah.
Correct.
And how long ago was this transplant? Was it a year, did you say?
It's close. He'll be a year in May, so
In
we're
May.
about 10 months in.
Oh, okay.
Almost there.
Amazing.
Yes.
And what do you think is the future of face transplant? Like, what do you see? We talked in the beginning of our conversation about all these flaps that have evolved, and now, originally you couldn't replace bone, but now you can replace bone, you can replace small muscles, the eye. How do you see things changing in the future, and what's sort of the biggest problem with the face transplant?
Yeah, it's a wonderful question. I think from a technical standpoint, it's doable. We could even begin to do smaller parts. What's happened in the field is that surgery has advanced tremendously. Now, what hasn't really caught up to us is the anti-rejection medications.
Yeah.
The anti-rejection meds are essentially the same.
Yep.
And I think if we were able to improve those medicines, and the reason why they're a concern is that, as you know, those rejection medicines, they come with a cost, not a financial cost beyond that, but it does come with some risk and morbidity and burden to the patients. Patients can develop renal failure, they can develop malignancies. So being exposed to these medications when it's not a life-saving organ like a heart or lung or liver, we're exposing the patient to some potential damage. So if those medications were to improve, then I think we can transplant smaller body parts.
Yeah.
And patients wouldn't have to have a multitude of operations for a suboptimal result.
Right. But wouldn't you argue that based on the patients that you've taken care of, that, these are life-saving operations? I mean, their quality of life before often these operations is that they're shut-ins and not leaving their houses, unable to really communicate with the outside world.
You're absolutely right. For them, they're not living.
Yeah.
You know,
Yeah.
you can have all your vital organs, but if you're trapped in a home and you're a social recluse,
Yeah. What kind of life is that?
they're not
Yeah.
living. They will
Yeah.
each tell you.
Yeah.
And every single one of these individuals, as you know, and I tell them, we don't know how long these transplants will live.
Yeah.
But if I were to give you 10 years of life, just as a hypothetical,
Yeah.
every single one of those patients will trade the life that they had with the injury to live 10 good years. And every single one of them will do it over again.
Yeah.
Over
Amen.
again.
I mean, and I know your team vets people and their families, and it's all very clear that this is, still experimental, and that you don't know, you can't guarantee any outcome, and they may lose their life,
That's right.
with the either the surgery or the aftermath, and they all go into it, eyes wide open and agreeing to that because
Right.
of the the hope that that their quality of life would be a little better.
And every single one of those 5 patients that I've done, even beginning with Richard Lee Norris, that I did his transplant in March of 2012, we didn't think we'd make it to 10 years, and we're
Yeah.
almost going on 12 years
12
soon.
years. Yeah. No, it's
You
amazing.
know? So it's great. So these patients are doing pretty well. And even the first one that we did here, Lex, is Patrick Hardison.
Yeah. Yeah.
We did him in 2015. He's on 9 years.
Wow. That was 2015.
We did him in 2015. That's
That was your
9.
first year here.
Yeah, that's right.
Wow.
And look at how well he's doing. They all have their bumps in the road. They have acute
Sure.
rejection episodes, things that we manage. But every single one of them will tell you they would never trade the life they have now to the
For
one
the
they
life
had.
they had. No,
They wouldn't do
amen
it.
to that.
Absolutely.
Well, Dr. Rodriguez, you are a gem, and you're a master
you.
surgeon. You're really an inspiration to me and to really everyone. Your creativity and your hard work and your intelligence approaching these really complicated problems. And I think, your courage and your kind of inspiration for humanity is really something. So I really appreciate you.
Well, I appreciate you. Thank you for the kind comment. It's wonderful to do this interview with you. And it's wonderful to do it with someone who's been an instrumental part of the development of this program here at NYU Langone. So thank you for allowing me to share this time with you today.
Thank you so much. And I'll have you back on the Dr. Zen podcast in a couple of months, and we can revisit what's going on with the face transplant.
I would love to do it.
Okay. Thank you.
Thank you. Fini?
Fini.